Bladder cancer is fairly common, so common it's one of the top 6 leading cancers, and it will affect more than 80,000 people alone this year. That's according to the American Association for Cancer Research. And for today's Health Watch, joining me now is Dr. Suzanne Merrill, a urology specialist at Skyridge Medical Center. Thanks so much for joining us today. So first, I want to ask, why is bladder cancer so common, and who does it mostly affect?
So bladder cancer probably is most common, as the biggest risk factor is smoking. Up to about 50% of cases are attributed to bladder cancer. And you're right, it is the 6th most common cancer worldwide. And actually, because men have a 3 to 4 times more likelihood of getting it than women, it's actually the 4th most common cancer in men.
Boy, so what signs and symptoms should we look out for?
Yeah, the most common is actually painless blood in the urine that you can see with the naked eye. Other symptoms can be irritative urinary symptoms, such as burning, frequency, urgency, and can actually look like a urinary tract infection.
And then how do you treat bladder cancer after a diagnosis?
So once we evaluate a patient for either that blood in the urine or these urinary tract infections that are being recurrent, we actually look in their bladder with a small scope that usually starts in the office. Once we see that a patient has what looks like a bladder cancer, then we would take them for a same-day outpatient procedure where we're able to and go in to the urinary tract with a scope and scrape out that tumor. That can be both diagnostic, let us know, in fact, is this indeed bladder cancer, as well as therapeutic if that cancer is just on the surface of the bladder.
You know, you talk about technology, and we understand that Skyridge has blue light technology that helps you as a surgeon. Tell us about that.
Yeah, this is a really great technology for both diagnosis of bladder cancer as well as for follow-ups in regards that this bladder cancer, many times for superficial bladder cancer, comes back very frequently. So what we do in this case, this technology allows us to instill a chemical into the bladder before we take the patient back for surgery. And it actually allows us to detect tumors both at diagnosis and follow-up more than 25% over baseline, and allows us to decrease the chance of that cancer coming back, as when we shine a special fluorescent blue light onto the bladder after this chemical has been sitting inside for a while, these tumors fluoresce pink. And so it allows us to see these cancers much better than we are with our regular white light scopes.
So just talk about the importance of just going to a doctor if you feel something is off and not right.
Yeah, of course, especially if you see blood in your urine with your naked eye, that definitely is cause for concern for you to go see your primary care doctor, or if you already have a urologist, to let them know what's going on. That certainly is usually the first sign that there may be something lurking in that bladder.
Even if you think it's a urinary tract infection, go get it checked.
That's correct. Actually, women, because many times older women have frequent urinary tract infections, we do see women actually being diagnosed at a later stage with their bladder cancer because they're often presumed to have a urinary tract infection. Still, blood in the urine, the most common cause is a urinary tract infection. So it's not off for the primary care provider if that culture is positive for bacteria to treat a patient for a urinary tract infection, even though there's blood in the urine. But after a patient's had multiple urinary tract infections in a row, they should see a urologist, because this is one of the things we look for to make sure it isn't present, which is bladder cancer.
All right, Dr. Merrill, all good information. Thank you so much for joining us today.
You're welcome. Thank you.
And of course, you can watch all of our health interviews right now on CBSColorado.com.